So in a kiddo who is very cooperative, who has a small cavity, who has a reasonable cavity risk, we try to do fillings most of the time. Argument for doing a crown, or kind of the judgment call that we would make when electing to do a crown, the factors that are involved in that are the child's cooperation. Fillings are technique sensitive. There can't be moisture contamination on the tooth, so if saliva gets onto the tooth while you're trying to place the filling, they don't stay on very well. They have a higher failure rate, so you need the child to be able to be cooperative so that you can keep it dry. The child should be able to have treatment done in the office. If a child has to be treated while they're asleep with sedation or anesthesia, we typically do crowns because they're more durable. If the child has a fairly high cavity risk, so you have a kiddo that has a very high sugar diet, or they struggle with brushing, the parents struggle with getting the teeth clean, and if after having like an objective discussion, it just seems unlikely that some of those habits are going to change, then we're more apt to say, you know, maybe we should just put a crown on this, because the crown covers the tooth and eliminates some of the future risk on there that would be possible with a filling where you're only fixing a small portion of the tooth. And then, you know, beyond that, the amount of cavities is a factor as well. If you have a kid with a lot of cavities, that can be indicative of risk, and sometimes those kids end up getting crowns rather than fillings.